to your microphone so the interpreters can hear you. We'll just go quickly over the agenda. We have a pretty packed agenda, so I'm very excited to jump right into the presenters. We're doing welcoming and opening remarks, and then an introduction to frame what the day is going to look like. We'll then talk a little bit about tools and guidance for action planning, as well as deeper dive into methodologies. We'll then hear from Colombia and Norway about their action planning for low carbon sustainability in health systems, and then the Netherlands on their greening public health. We'll then have facilitated Q&A time to talk to those presenters with any questions that you might have had throughout the presentations. We'll then do an introduction to a diagnostic tool, and there'll be an opportunity to ask questions during that time as well. And then we'll finish out with any next steps and closing after that. So without any ado, I am going to kick it off to Dhiramit to start our welcome. Thank you.
Thanks very much, Cara. Thanks to everybody who has joined. And it's a real pleasure to just say a few words on behalf of WHO as we kick off this ATACH meeting in partnership with our good ATACH partners from Healthcare Without Harm. And first off, just to underline the importance of this issue overall for WHO. Those of you who follow the World Health Assembly or WHO closely will know that climate change and health is now the first of only 6 strategic priorities for WHO member states and the WHO Secretariat. And just in the last week at the World Health Assembly, following the approval of a World Health Assembly resolution on climate change and health last year, we had the passage of a new global action plan on climate change and health last week with overwhelming support, with some challenges which we have to acknowledge. We have to be careful to take everybody with us on this journey, and we'll be making efforts to ensure that, but overwhelming support in general for stronger action on climate change and health. And it's a real pleasure to be doing this in partnership with others and under the ATACH umbrella. The ATACH continues to go from strength to strength. I believe we're now at 94 countries who have signed up to one or both, usually both of those commitments that started at the COP in Glasgow, and I think over 70 development partners who are engaged in this journey together. And then the subject of this meeting is really important as well. Within that global public health agenda that I just described, there is a role for health in mitigation, both in society as a whole, but specifically within the health sector. And that's not surprising, considering that the health sector is responsible for about 10% of GDP and somewhere in the region of 5% of greenhouse gas emissions. So it really matters what the health sector does, both as an important part of the economy and people's lives, but also as a trusted example to others. And in our case, it's extremely clear from our side that we need to promote sustainability, and we need to promote that in a way that also enhances and improves public health and also the provision of health services. We must never do anything to undermine provision of excellent services for health, but we can do that in a way that also reduces the environmental impact of those services that we provide. And that's basically the purpose of this gathering and the purpose of the technical guidance that we and others have been working on and we'll be sharing some of in this seminar. And I would also say, most importantly, it's the subject of the experiences that you will hear from the partners who will present during the course of this meeting. And just the final word I'd like to say on this is that that's probably the most important part of this, because we recognize that promoting sustainability and eventually getting to net zero healthcare means different things in different parts of the world, whether it's a high-income country, a middle-income, or a low-income country. So those journeys will be different, and it's really important that we're hearing from a variety of different countries over the course of these meetings. So once again, a real pleasure to welcome you, and I'll hand over to Diana from Healthcare Without Harm.
Thank you so much for that, Diarmid, and so nice to see you all join us this morning in the eastern side of the world, and evening to those of you in the Southeast Asia region, and the West Pacific. So I'd really like to welcome you to today's session. We developed it, we designed it so that it is not just informative, but it's also a way for countries to share their experience, as Diarmid said, for us to also share experience as we've been comparing the different ways in which roadmaps and action plans have been developed around the world, and how that helps you if you haven't yet started your journey, or if you're just starting it and you need some guidance. We hope that you can come out of this session with some really practical knowledge, guidance, and tools to move forward. I'm going to share my screen now because I just wanted to kind of get us to a common understanding of why we're here today, right? The first, and if I'm sorry if you don't know me, I am Diana Biconmanjari. I'm the International Climate Director at Healthcare Without Harm, and I've been working with a team of people around the world on helping countries and health facilities do their baselining and their action planning and road mapping in low carbon sustainability. Why are we here today? Really is because many of you obviously have signed up for the COP26 Health Program, which has very specific ambitions around low carbon and sustainability. And what countries committed to, and I want to remind us all of this, those who with high ambition or that are high emitters are trying to commit to set a target date by which to achieve health system net zero emissions, ideally by 2050. But all countries that had this committed to deliver a baseline assessment of greenhouse gas emissions of their health systems that include the supply chain, along with an action plan or roadmap by a set date, and that considers also other things such as human exposure to air pollution and the role the health sector can play in reducing the exposure to air pollution through its activities and its actions. So very much everything connected to also the climate plan of action that WHO launched around WHA, as well as the global plan of work that was also launched around WHA. But one of the main things that we've been considering is what is a roadmap and what is an action plan. And even though we don't have specific definitions for these two, as we've been seeing of what has been submitted to the ATACH community of practice, and for the purposes of this session, and what our lessons learned have been telling us is that a roadmap is a vision that delineates the pathways to get from the current projection or a business as usual scenario to a Paris Agreement aligned scenario. And that it includes an analysis of priority areas and how mitigation will be considered based on development trajectories, health development plans, universal health coverage of different countries. So different countries, different contexts, different trajectories. An action plan is something that we are all very familiar with as well in terms of developing. It's in the case of ATACH, we've seen countries that have delineated work plans and into steps to actually develop an action plan or a strategy or a roadmap, or a plan that already has a baseline and targets and activities and a budget, something that it would be very common to see in other areas of work around health as well. But where are we today on this and how have we progressed? So since 2020, which is when we have data from countries, I would say that this data that I'm presenting right now is the most recent data that we have. And out of 88 respondents of countries that are in ATACH, we see that worldwide about 59% or 60% almost have still not started their baseline. and about 70% of countries haven't started yet their action plan or roadmap. Now, we have some regions around the world that are a little more ahead, namely the European region, in the WHO Europe region, the WHO Western Pacific region. Those regions have 75%, 80% completed or started baselines. In the case of Europe, 65 have started or completed their action plans, whereas in the Western Pacific is 2%. But that you compare to other regions that may not be as advanced, although they are advancing little by little. The Americas, 21% have completed action plans. Southeast Asia, that number is about 38%. But the Eastern Mediterranean, that's less than 15%. And Africa is also less than 20% for doing action plans out of the countries that responded. So it's important to know that there is progress, but we still can also do much more. And this is why we're here today. In Madrid a year ago, we realized that there were still some challenges that countries were facing and some country needs. Today, my hope is that not only do you get out of here with some tools, as I said, and some guidance, but also more understanding of how to choose the right methodology to gather the information that you need in order to do an action plan or baseline. Or an action plan or roadmap, that you have these case studies and lessons from other countries in doing these exercises, and how to have the effective governance structures within the MOH and the stakeholder engagement that is required in order to do these. So without further ado, and before we move on to the next part of the presentations, I did want to launch one poll for you guys to talk about and tell us, what are your motivations really? And Kara, either you or Claire, I think, are going to help us with the poll. Thank you. We wanted to know, what is your motivation for doing this type of action plan or roadmap? Maybe it's to finance low carbon or sustainability actions. Maybe it is to do that roadmap analysis to understand the different trajectories, or formulate a policy or advocacy piece nationally, build capacity within your health authority, or perhaps other. So if you can please respond to this, and we will share the results in a minute. Thank you. Kara, can you confirm that we're getting answers?
We are getting answers. And Claire is running the poll, so she will share results here. We're about almost at half of participants have answered.
Excellent. I think that we can share the results now and move on to the next part of the presentation. Thank you. That's great. So we see that a vast majority of you are talking about building the capacity within health authority to systematically track and reduce emissions, which is really great. And a little bit more even around the first three options as well, but also really great answers. Thank you so much.
All right. Thank you so much, Diarmid and Diana, for that great welcome and introduction to help us start framing what the rest of the day is going to look like. So we'll now kick it off over to talk about tools and guidance for action planning and low carbon sustainability in health facilities with Carlos from the World Health Organization's Climate Change and Health Unit. Carlos, over to you.
Sorry, I had to stop sharing because my audio was not working. It's working now, and you can see me as well. So
Yes.
while I do this, I'm Carlos Corvalan, and just want to thank Amy Savage, who put this presentation together. And so please let me know if you can see it in full screen at the moment.
Yes, we can.
Yes. Okay. So I'm going to briefly talk about what is happening regarding action planning for low carbon and sustainable health systems and facilities. And what you see here are steps that are not set in stone. this is what we have observed that countries have done. There may be different ways to organize this. There may be more steps or less steps. But what is important is that these are more or less what comes out from work done by countries. First, that you need a quote unquote one by one as we speak, so I'm not going to read them all. But let's start first with the political and stakeholder engagement. So we see this, countries see this as an ongoing process. This is not one step and you stop, but it goes through the whole work that needs to be done. This brings political buy-in. We need to engage other sectors, ministries, the focal points leading the national climate change agenda. We need the health determining sectors. And of course, we need to align with the different national and international processes that are happening. So this is a very comprehensive step then that goes along the whole process. Evidence and assessment, of course, we always speak about this, and we need to understand, for example, the emission hotspots, whether scopes 1, 2, or 3. And we know that this depends on the local context, so it's not something that we can sort of dictate. Things are different everywhere. There are different ways to make emission estimates. You have this overall approach in which you measure the whole system sort of in an academic way, because it's very hard to do by anyone. But the bottom-up approach is being promoted by Healthcare Without Harm and the ATACH Development Network, in which you go to a health facility and you start identifying where the greenhouse gas emissions are coming from and identifying hotspots and having actions to reduce the emissions. If you want to know what your country emissions are, you can go straight to the Lancet Countdown. They have it online. So any country is listed there. This is very useful indeed to know how serious are the emissions in your health sector. The problem with that, which is a top-down approach, is that you don't know where the hotspots are, so you don't know where to act. You just know that you have a big problem. We need to set targets, no doubt, and targets, again, are an issue of national, local circumstances and priorities. But importantly, there are already targets in other sectors, energy, air quality targets that needs to be aligned, or also aligns with other processes like NDCs and long-term LEDs, etc. So overall, the setting targets is a process that is not done by the health sector alone, but it's in consultation, or at least in reviewing what is happening at the national level in other areas. To identify interventions, this should be done ideally in a best case scenario based on evidence. And you can also set targets or identify targets, but often we don't have this. So the reality is that countries will want to identify interventions, but they don't know how to proceed. And in this case, we don't want countries or agencies to stop and not act, but on the contrary, to identify win-win interventions that do not require a big investment to complete. So here are some examples of energy efficiency actions like solar electricity to replace diesel, low emissions and anesthetic gases. And you've probably seen a big list of these possibilities of reducing emissions, reducing the carbon footprint without knowing exactly what is the real situation in the country. However, not everything is difficult, because WHO has produced this guidance that you see there, and all of these three documents have long lists at the end of possible interventions that would help you review your health facilities or health system areas and implement some of the interventions that are mentioned here. Continuing with identifying interventions, you're familiar with the WHO's operational framework for climate resilient and low carbon health systems. So what you see there is the 10 steps of the operational framework. And then you see there the 3 scopes and how each of these components are linked to 1, 2, or the 3 scopes. And in fact, what we found out is that they are all linked to all the scopes. The only difference is that some of them are very direct, like the one in green, or some of them are less strong or rather indirect, as in the ones in orange, yellow. And finally, in this area, we need to develop criteria for prioritizing interventions, looking at the created health gains, the feasibility and resources available, the capacity that we have, and then, of course, always building synergies with adaptation and resilience actions, aligning with all other efforts that we're familiar with. This is just to illustrate sort of like the pathways that countries may need to follow. If you think of countries that are in that box label number 1, they have low health system performance, but they have low or very low health sector greenhouse gas emissions. So for those countries, we don't want them to focus on the low carbon. We want them to focus on building climate resilience, improving their health system performance. But at the same time, they should be adopting sustainable low carbon technologies. In the other side, we have countries with very high health system performance, but unfortunately, they have also very high greenhouse gas emissions. So we want them to focus on reducing the emissions to zero towards 2050, but without sacrificing all the good efforts they have in building climate resilience. So the other step is to develop a plan, an actionable plan. So the question would be how we break down interventions into actions, working at the subnational or healthcare facility level. We need to assign the roles and responsibilities, identify timeframes, the costing, the capacity needs, capacity assessment, and nevertheless, and still having to develop a monitoring and evaluation framework, which is we're going to see later in step 8. And again, here some example of guidance available that can help us doing this. And I think that this is the one that most countries have difficulty with, which is accessing finance. Some countries have been successful and things are moving in the right direction, but historically has been very difficult. There is international funding available, maybe not as much as we would like, but there is available. So we have bilateral donors, the health funds, multilateral development banks, private sector. We need to think of innovative financing. We have the climate change funding streams that we all know. And so I think some countries are doing good efforts, but if not, WHO and ATACH partners would be able to support the development of funding proposals working with countries. And the last step in implementation, monitoring, and the continuous improvement of the work. Of course, we need capacity building. We need to build protocols. We need to work and decide whether we're thinking national, subnational, or both. Again, we need to align with all these ongoing global processes. We need indicators. We haven't been great in developing indicators. I think the good efforts have been done now in WHO with the general program of work, which we need to monitor, as Diamida explained. One of the strategic objectives is climate change, so we need to monitor that. We have the global goal on adaptation from the UNFCCC. But in this case, we need indicators to measure how well we are implementing the plan, how much we are reducing emissions, how much we are progressing towards targets, and overall towards a low carbon sustainable health system. And finally, as you know, because you are from the ATACH community, most of you, in the webpage of the ATACH community, you will have links to tools, links to what countries are doing, and a lot more. So with this, I leave you and thank you very much.
Thank you, Carlos, for the sorry, having some technical difficulties here. Thank you, Carlos, for that fabulous presentation and the clear steps and guidance in this important work. We're going to jump now into a deeper dive into methodologies to developing national and facility level action plans and roadmaps with Andreas Ekvall of Healthcare Without Harm. Andreas, I yield the floor.
Thank you, Cara. Yeah, hi everyone, and welcome to my part of the session. My name is Andreas Ekvall. I'm a Senior Climate Officer at Healthcare Without Harm, and I'm the project lead for mitigation projects in Europe. Firstly, I'd like to thank the World Health Organization for the opportunity to co-host this vital technical meeting, and of course you in the audience for joining us today. With COP30 on the horizon, the urgency of our topic cannot be overstated. And the healthcare sector has a critical opportunity to both advocate and take a lead in decarbonization by proactively planning to reduce its carbon footprint. Since 2019, we have developed a series of resources with ARUP. When we published Healthcare's Climate Footprint, we positioned healthcare as a critical sector for decarbonization, responsible for 4.4% of global net greenhouse gas emissions. Recognizing the scale of the challenge, Healthcare Without Harm released a global roadmap for healthcare decarbonization in 2021. This roadmap revealed the need for all health systems to act, while warning that inaction could result in sectoral emissions tripling by 2050. This call for decarbonization was reaffirmed in 2023 when the Lancet Countdown report concluded that healthcare sector accounted for 4.6% of global net greenhouse gas emissions. Healthcare Without Harm has supported the decarbonization efforts of national health systems over the last few
Andreas,
years.
I'm so sorry to interrupt you. The audio got very quiet. I'm not sure if there's a way to speak a little louder or maybe get closer to your mic.
I'll try to get closer. Thank you. Is this better?
Yes, it is. Thank you.
Perfect. Our project methodologies for action planning have been tailored to the needs of our partners, but can be summarized along 3 different lines. The first is a top-down approach. Carlos introduced this very nicely, and this is where we use national or sub-national secondary data to drive an action plan. Its advantages include accessible data, valuable insights into supply chains, and an understanding of the overall scale of emissions. An example of this approach is the Global Roadmap for Healthcare Decarbonization. The second contrasting method is the bottom-up approach. This relies on facility-level data gathered directly from surveys, specific expenditure figures, and activity data. This approach can achieve a high degree of accuracy and action guidance. To empower health systems, we published Designing a Net Zero Roadmap for Healthcare in 2022. In Operation Zero, we strategically use this methodology to integrate the benefits of both previously mentioned methods to create the most accurate roadmap using a hybrid approach. Operation Zero is based on the vision of every country developing an emission baseline and a national healthcare decarbonization roadmap to reach either low carbon or net zero healthcare. The methodology used for Operation Zero tends to follow 7 steps, but they are adapted to the needs of each partner. Think of this as an example of what a roadmap or an action plan potentially could contain. First, we try to establish an understanding of the healthcare sector by mapping its structure, existing climate policies, networks, and critical governance frameworks. This creates a solid basis for an integrated roadmap or plan. Next, we map and engage key stakeholders by developing a tailored engagement strategy. We foster collaboration and we secure the buy-in for the development and implementation of the roadmap. Thereafter, we established an emission baseline through comprehensive data collection and greenhouse gas emission modeling. With a solid foundation established by the 3 first steps, we proceed to action planning. First, we need to set a healthcare mitigation target. This involves aligning the target with a Paris-aligned reduction trajectory and establishing a carbon budget. Next, we project the health sector's emission to the target year. This is a forward-looking analysis that anticipates sectoral growth of emissions, providing a vital reference point for climate action planning. Following this, we identify and evaluate the reduction potential of different actions, ensuring a pathway of reductions aligned with the Paris Agreement, bridging the emission gaps through action, deriving a roadmap or plan aligned with previously defined targets. Finally, we document our findings and outline clear next steps to ensure continuous improvement. Implementing a project similar to Operation Zero or an action plan requires addressing several challenges. These challenges often overlap on a facility and health system level. The most common challenge is technical challenges due to the methodology's complexity. Operation Zero requires the integration, collection, and analysis of diverse and large-scale data sets, alongside what often can be seen as very complex modeling to determine the effects of mitigation actions. Secondly, developing a robust and granular emission baseline presents data challenges. Securing comprehensive and accurate data is critical for a clear and reliable starting point in action planning. Roadmap development can also require significant financial resources, time, and specialized technical capacity. Additionally, the roadmap needs to be aligned with the diverse organizational structures, existing plans, and mandates, which typically poses a project coordination challenge. Finally, effectively managing stakeholder expectations and ensuring participation in developing the roadmap causes inherent stakeholder challenges that must be navigated to create a roadmap that is relevant for the healthcare sector. Having identified the potential challenges, I'm now going to focus on proactive recommendation on how to reduce them. Our first recommendation is to conduct a diagnostic assessment, which involves getting a comprehensive understanding of the roadmap's goals and purpose and any potential gaps. What are the key stakeholders? What is the resource availability, existing structures, and potential technical challenges? Secondly, we recommend tailoring the roadmap's content to align with the specific needs, context, and capabilities of the health systems. That's being defined in the first step. Achieving this also involves incorporating the invaluable feedback of experts and key stakeholders to shape a roadmap that is ambitious and achievable. And our third recommendation is enhanced data collection to secure high quality and representative and also comprehensive data. And like I said before, this is the bedrock for action planning and measurable progress. And this necessitates developing a data collection plan through active collaboration with key stakeholders, and it also provides the foundation for updating the emission inventory. Our fourth recommendation emphasizes project coordination to secure strong collaboration between different governmental actors and key stakeholders. And this is achieved by executing a comprehensive project plan. Our fifth and maybe most vital recommendation is to secure stakeholder engagement. This can foster collaboration among the relevant parties from the initial roadmap development through its implementation. And this requires a strategic engagement strategy that ensures stakeholders are included, kept informed, aligned, and engaged. And our sixth recommendation is investing in core competencies. It's essential for securing and cultivating the skills needed to develop and maintain the roadmap. And this involves assessing the team's current capabilities, then providing targeted training or finding specialists as required to develop the roadmap. By successfully navigating the different challenges of healthcare decarbonization, a lot of potential issues can be reduced, and both the baseline and roadmap can be highly aligned with the needs of the health system and the context. And by incorporating these strategic recommendations, we hope that you can get closer to this. And when these challenges are strategically navigated, hybrid approaches such as Operation Zero demonstrate a high degree of replicability and a high scalability provided accurate capacity or support, or adequate capacity. The accuracy, comparability, and actionability is, however, in general medium, and this is influenced by the data, the modeling, methodology, and the mission factors. However, by refining the initial baseline with bottom-up data and providing and improving the models for interventions, its accuracy, comparability, and actionability can be significantly boosted. At Healthcare-WHO, Tom, we have a long tradition of working bottom-up with action planning, and we have developed guidance, tools, and resources for each step in the process, from calculating to managing a carbon footprint. And in essence, this process follows 5 steps. First, we often start with increasing the carbon management literacy of the health system. 2, we collect the data required for a carbon footprint. 3, we calculate the carbon footprint, and besides our own tool, Climate Impact Checkup, Aga Khan has developed a fantastic tools that are used by health institutions across the world. The 4th step is to create a climate action plan. The content can resemble what I described in Operation Zero. 5, and maybe the most important step, is to monitor, track, report, and update the greenhouse gas inventory and the action plan. Importantly, the greenhouse gas inventory and action plan can reflect the facility level, but can also be aggregated to reflect a national health system. Bottom-up decarbonization projects usually excel locally with high replicability, scalability, comparability, and actionability. The core challenge lies in translating this to system-wide representation. Representative sampling offers a path forward, like the work of Colombia, or the strategic limited sample of healthcare facilities that reflect the health system, like Nepal. Both approaches boost overall actionability and policy guidance for a national health system. However, extensive data collection is required for a representative sample, which affects its replicability and scalability, but it can ultimately build an effective national carbon management system, leading to the possibility of creating a national dashboard similar to that of the work of Norway. Conversely, limited samples are easier to replicate and scale, making them efficient for understanding the scale of emissions and high-level policy. But on the other hand, their system-wide actionability hinges on how representative the data is for the health system. With this presentation, I have aimed to give you a snapshot of the methodologies and lessons learned from our projects on action planning. And now I would like to understand how you in the audience are working or advocating for action planning. This could cover the methods you're using, challenges and potential opportunities that you are experiencing, or how you're navigating them. Please let me know in the chat. Also, if you have any questions, you can either address me directly in the chat or during the Q&A session. And also, please feel free to contact me by email. Thank you for listening to this part of the session.
Thank you, Andreas. Fabulous information about methodologies, and please, as he said, put your input in the chat there, and also feel free to reach out. We are going to jump now over into some of our country presentations. We're going to learn about Colombia's action planning for low carbon sustainability in health systems and facilities. Please note this presentation will be in Spanish, so if you need to listen to it in English or French, you can jump down to that interpretation button here on the Zoom call. Also, a quick housekeeping update for future presentations. We do also have Spanish interpretation, so my apologies for not having that mentioned earlier in the call. But for now, I'm going to pass the screen over to Diego Moreno Heredia with the Ministry of Health and Social Protection with Colombia.
Bueno, muchas gracias. ¿Me están escuchando bien?
Sí, te escuchamos, Diego.
Ok. Vale, entonces, pues no, muchísimas gracias primero que todo por la invitación. Realmente para Colombia es muy importante que se conozca el trabajo que se viene realizando en cambio climático y salud desde hace unos años, tanto en adaptación como en mitigación. Y entonces, pues hoy les voy a contar acerca de un proyecto, les voy a contar de una manera muy rápida acerca del proyecto que se hizo con el apoyo técnico de la organización Salud Sin Daño y nosotros como Ministerio de Salud y Protección Social de Colombia, que fue la estimación de la huella de carbono del sector salud como ese primer ejercicio o ese primer dato que podemos tener frente a mitigación de cambio climático, por lo menos de la huella de carbono. Como antecedentes, quisiera mencionar que antes de hacer este proyecto, nosotros hicimos una revisión de las experiencias que existen a nivel mundial, a nivel Latinoamérica y, por supuesto, a nivel de Colombia, frente a mitigación de cambio climático desde el sector salud y emitimos una guía de mitigación de cambio climático con generalidades de cómo veíamos el sector desde el punto de vista de la reducción de emisiones de gases de efecto invernadero eh, y pues obviamente en cuanto a las acciones que se venían realizando de mitigación en el sector. Aparte de esto forma parte de, de un ejercicio que se viene haciendo de la formulación del Plan Integral de Gestión de Cambio Climático del sector salud, que está por ley bajo la Política Nacional de Cambio Climático del país, en donde el sector debe realizar, perdón, un plan que integre mitigación y adaptación a cambio climático. Y por supuesto ya habían unos ejercicios previos que se tenían desde la red global de hospitales verdes y saludables de la organización Salud Sin Daño, en donde ya se habían venido realizando mucho antes de que nosotros iniciáramos con este proyecto, ya se han venido realizando algunos ejercicios. Entonces, pues el objetivo fue estimar precisamente la huella de carbono de hospitales tanto públicos como privados en Colombia, incluyendo las 5 regiones principales del país. Como línea del tiempo, es importante mencionar que se comenzó a trabajar desde 2021, desde octubre de 2021, entre el equipo de Salud Sin Daño y el Ministerio de Salud, pero realmente en 2022, a comienzos de 2022, se firma un memorando de entendimiento entre la Organización Salud Sin Daño y Ministerio de Salud para iniciar formalmente el proyecto. Ya duramos cerca de 7 meses definiendo la metodología y haciendo todo el muestreo rigurosamente desde la parte estadística, para después ya comenzar a hacer capacitaciones a los diferentes hospitales que se inscribían, donde se inscribieron más de 400 hospitales y posteriormente se hizo unas mediciones, algo que se llamaban huellatones, pero son unas mediciones tanto presenciales como virtuales de la huella de carbono bajo la guía del equipo técnico de Salud Sin Daño. Ya en noviembre de 2023 logramos presentar los resultados preliminares para finalmente entregar el reporte final y, y el resumen ejecutivo en octubre de 2024. Yo estoy escuchando como un retorno, pero bueno. Eh, ¿por qué, por qué es importante el proyecto para nuestro país y por qué fue importante? Primero porque lo que hace es apoyar el cumplimiento de las metas de mitigación que tiene el país, que se establecieron en la CNDC. El país establece que va a reducir el 51% de las emisiones de gases de efecto invernadero a 2030 con respecto a su medición de 2014. Además de esto, pues es bien conocido que Colombia tiene dentro de su política de gobierno la transición energética y temas de mitigación de cambio climático. Por otro lado, también se promueve la importancia pues de reducir las emisiones en el sector salud, lo cual ha venido aumentando, pero aún se debe seguir fortaleciendo. Sirve también como, como base, podemos decirlo, para el componente de mitigación del Plan Integral de Gestión de Cambio Climático del sector salud. Y muy importante es que se convierte en el primer ejercicio de estimación de huella de carbono que involucra un buen número de hospitales y que sirve además de modelo para otros países que lo han venido desarrollando, pero según tengo entendido, somos de los países que tiene eh, más hospitales en un solo ejercicio. Entonces, esto fue a través de una metodología que han venido hablando en las presentaciones, que es la metodología o desde un enfoque ascendente, desde un enfoque bottom-up, en donde los hospitales nos dan los reportes y eso se convierte en un dato que es utilizado a nivel nacional. Esto solamente para mencionar todos los que se presentaron, los hospitales que se presentaron, lograron verificarse y aprobarse los reportes de 265 de ellos, los cuales estuvieron distribuidos en niveles de complejidad, del tipo de institución y las regiones, que ahí se puede ver claramente el nivel de complejidad, pues el mayor porcentaje fueron centros de salud de complejidad baja, seguidos por complejidad media y complejidad alta. Y en cuanto a tipos de institución, fueron casi 3 veces las instituciones privadas que las instituciones públicas las que fueron, las que participaron. Al igual, en las regiones, y esto es de cierta manera un inconveniente que tiene el país, y es que se centralizan los hospitales o la prestación del servicio en algunas zonas específicas. Por eso, la región andina, que es como una central del país, tiene el mayor porcentaje comparado, por ejemplo, con la región amazónica, que tiene muy pocos hospitales y pues proporcionaron muy pocos datos. En resultados, mencionarles que había unas fuentes obligatorias y unas fuentes no obligatorias. Las fuentes obligatorias que tuvieron los 265 reportes, en la que tuvo un mayor peso en cuanto a las emisiones de gases de efecto invernadero, pues fue residuos, después de residuos, seguido por electricidad y por combustión estacionaria y combustión móvil finalmente. Mientras que las fuentes no obligatorias se presentaron 159 reportes sobre gases refrigerantes, lo cual equivale a 306.443 toneladas de gases de CO2 equivalente. Y los gases medicinales y anestésicos con un total de 322.522 toneladas de CO2 equivalente a partir de solamente 81 reportes recibidos. Si uno comparara las fuentes obligatorias con las no obligatorias, sigue siendo mucho más amplias o generando una mayor carga de emisiones las que se consideraron como no obligatorias, a pesar que no estuvieron en todos los reportes. Como desafíos y limitaciones, es importante mencionar que un desafío para el país fue siempre obtener los datos de las fuentes que se requerían para la herramienta que utilizaba la Organización Salud Sin Daño, que es la herramienta de monitoreo del impacto climático. Y también llegar a esa muestra representativa porque se hizo rigurosamente desde el punto de vista estadístico, especialmente para conseguir la muestra en regiones que son muy limitadas, tanto en tecnología como en acceso. También un desafío fue llevar a cabo 5 eventos presenciales que se hicieron en el país y se hicieron algunos también virtuales. Y finalmente, una limitación y un desafío que creo que siempre vamos a tener los países es, aparte de consolidar los datos, cómo se comunican estos a los diferentes actores y a las diferentes partes interesadas, y cómo se diferencia esa manera de comunicar esos datos. Recomendaciones que surgieron del ejercicio fue, por un lado, pues, que se deben desarrollar planes de acción climática para cada hospital o para cada red de hospitales, de acuerdo a unos elementos mínimos que se deben proporcionar desde el nivel nacional, en este caso desde el Ministerio de Salud. También lograr asegurar una capacitación continua, una asistencia técnica, no solamente a las personas de gestión ambiental, sino también a profesionales de la salud que pueden estar involucrados y sobre todo a tomadores de decisiones en la, pues, que se encuentran como gerentes o como líderes dentro de estos hospitales. Promover también la implementación de planes de acción eh, eh, para proporcionar como una guía técnica, para proporcionar acercamiento a subsidios y accesos a fuentes de financiamiento, también es muy importante. Y finalmente la recomendación frente a fortalecer esos programas o la adopción de esos programas que contribuyen a la descarbonización del sector, tanto lo que se viene haciendo en residuos, como lo que se viene haciendo en temas de energía eléctrica pues, energías renovables y todo el tema, como sucede también, por ejemplo, con telemedicina, que se viene avanzando también en el país en ese aspecto. Y termino con lo que sería la utilidad, lo que consideramos ha sido la utilidad de este proyecto y cuáles son los siguientes pasos. Y es principalmente que, como mencionaba al inicio, sirve como de una línea base, o sirve de ese primer dato y ese primer ejercicio que se ha hecho de mitigación y que va a aportar para la formulación del Plan Integral de Gestión de Cambio Climático del sector salud, que va a ser lanzado en este año en el marco del Comité de Cambio Climático que tiene el sector. También pues, se propone que se continúe con una medida en lo posible anual, pero si no se puede anual, puede ser cada 2 años de esas emisiones del sector para poder monitorear y hacer ese seguimiento realmente, si se ha venido avanzando en acciones de mitigación y cuántos más también se han venido sumando a este ejercicio. Y por último, pues es muy importante poder establecer mecanismos precisamente de monitoreo y reporte de ese progreso, que apunten pues a esa mayor ambición. Si se quiere llegar a una descarbonización planteada a 2050, como lo dice la política, la estrategia climática de largo plazo del país, pues el sector salud tiene que comprometerse también con este incremento de ambición y mejorar el desempeño ambiental dentro de sus instituciones de todo el sector salud. Entonces, pues muchísimas gracias por escucharme y quedo atento a cualquier pregunta.
Thank you very much, Diego, for that great presentation on all of the important work that Colombia has been doing. And if you have questions, please make sure to drop them in the chat. And as I said, we will have a Q&A in just a little bit. So now I will pass the floor over to Dr. Erlen Tuset Asheim, who will be talking about Norway's experience. And Dr. Erland is with the Norwegian Directorate of Health.
Thanks very much. I'm delighted to join you, and I will share my screen, but I think maybe Diego has to stop sharing his screen first. Hope everyone has a great day, whether it's morning, afternoon, or wherever you are. Let's see. Can you see my slides now? Oops.
Yes, we can.
Okay, great. So in this presentation, I want to speak briefly to the Norway context first, before I go into the baseline assessment and the roadmap that we've developed as a result of the COP26 health program participation. And then I will share some examples of emissions data, which is one of the important tools for implementing the roadmap. And I will give some early reflections on how we're doing with the roadmap, which we launched earlier this year. So without further ado, I'm going into to the presentation. So I often start presentations given domestically with an overview of the climate and health initiatives that internationally that Norway supports. Clearly there's been a lot of policies across sectors in Norway for a long time to promote the transition to towards a more sustainable, low carbon society. But in terms of the health specific focus, there's been a great increase in recent years. And that has been greatly helped by the COP26 health program and the subsequent initiatives that Norway has supported. And Norway also, of course, supports the 14th General Program of Work, which Diarmid referred to. Now, I would say in the hospital sector in Norway, there has been initiatives going on since 2008. But as a whole, I think it's fair to say that many initiatives in the sector have been a result of individuals engaging and not necessarily because of structures and actions taken by leadership. So these the COP26 health program has really helped to make a change here. So as regards the Norwegian health system, I'm not going to go into all the details of this slide. I'm sure there's only a handful of people in Norway who understands everything in it. But in terms of understanding where health sector emissions come from and how we can work to help reduce those emissions, it's important to understand the difference between how the governance structure is for the hospital sector or specialist healthcare services in Norway and primary healthcare, which is delivered by municipalities. So the hospital sector is led by 4 regional health authorities, and these are sort of under the direct governance of the Ministry of Health. So here it is a fairly or much more straightforward chain of command, so to speak. Whereas in municipalities who are responsible for delivery of primary health services and care services, the municipalities, of course, are also responsible for delivery of a range of other services such as schools, water, sewage, etc. And this is under local political control. So for the Directorate of Health and the Minister of Health, we don't have a direct line of command or influence to the same extent. So that's briefly about the Norwegian context. So here are the main findings that we had and the main recommendations when we undertook our baseline assessment as a result of joining the COP26 health program. And there is a brief summary of this of the report available in English, which we published in the Journal of the Norwegian Medical Association a couple of years back. So what we found was basically that specialist healthcare services or hospitals and primary healthcare services appeared to contribute roughly the same amount of emissions. Now these numbers shown here were fairly conservative estimates, so subsequent based on extrapolation of the data we had available at the time. Subsequently, we have had a national data set from specialist healthcare services, which show that the emissions are somewhat higher than what we estimated 2 years ago. So that if I were to guess, I think an up-to-date national estimate would be that emissions are around 5 megatons, or a little bit below 1 ton CO2 equivalents per capita per year. The main recommendations were on 3 themes. We recommended to strengthen data for a range of purposes to help drive greening of the health and care sector. We recommended to try and engage the sector with a shared or joint direction in this work through identifying areas for reducing emissions. And the roadmap I will speak to helps with this. And we recommended to increase knowledge and collaboration in this space. So moving on to the roadmap, which we started to work on after we had completed our baseline assessment. So we were a fairly small team working on this in the Norwegian Directorate of Health, but of course we engaged closely with the hospital sector and with municipalities who we perceived to be front runners in this work. So what we wanted this roadmap to contain was to bring together a lot of specific examples of actions that could be taken in the health and care sector under various domains. We were clearly inspired by roadmaps already published by others, such as the UK, the France roadmap, worked on Denmark, etc. And we have published this roadmap earlier this year, and the QR code on this slide will take you to a website where there is an English version available. I can share a link in the chat afterwards. So basically we there is a question, how do you sort of define the action areas when you put together the roadmap? And we ended up with these 6 key action areas: healthcare and prevention, procurements, travel, circular economy and waste, buildings and energy, and digitalization. So I'm not going to go into the details of all of these, but I will go into the first one, healthcare and prevention. At the same time, I could highlight that procurement of goods and services is perceived as a very important area due to the high amounts of emission tied up in the supply chains. And these other areas will, of course, be very important as well. Now, digitalization is more a question. Is it a separate area, or is it an area that cuts across? We wanted to keep it as a separate area to highlight the importance of this theme. And one reason is that of course, digitalization can be part of the solution, but also use of technology is a driver of emissions. Finally, there is an important point that there is a lot of resources and attention assigned to driving the digital transformation in health and care. So if you can sort of pair the digitalization agenda with the greening agenda, then I think you've come a long way to get this area the attention it requires. So the roadmap itself contains a long list of individual actions based on examples of good practice, national guidance, etc. So action areas under the area of healthcare and prevention are summarized briefly here. So we have subcategories, which I've put up here. And in the domain of medications, we focus on inhalers, anesthetics, but also prescription habits and ways of administering medication in a broader sense. So, for example, the use of oral agents instead of intravenous agents. We also have a chapter dealing with overuse of services. So this ties in with the choosing wisely agenda, for example, trying to optimize or eliminate the unnecessary use of diagnostic tests and treatments. We also focus on dietary advice to patients as well as in facilities and care settings. We speak to patient safety guidance and action plans. And this helps to illustrate that normally when we talk about greening the health and care sector, there's a lot of win-wins in terms of maintaining and improving the clinical effectiveness and safety of patient care. So in terms of actually being able to make these changes happen, we have a dedicated chapter called Tools to Succeed, where we have three main areas. These are areas that are sort of similar to the areas we recommended to look at when we did our baseline assessment. So I'm going to speak in particular to the first one here, which is in relation to data or greenhouse gas accounts and budgets. But this ties a lot together with leadership as well, because we want to showcase how data can be a tool for leaders in the governance of their organizations. And in the words of the Secretary of State for Health, who has written a preface to the roadmap when it was published earlier this year, the goal of the roadmap is really to inspire all of us working in the health and care sector to integrate climate perspectives into our daily work. So not as something that happens on the side, but something that is integrated into everyday practice. So this slide shows a summary of emissions from the hospital sector in Norway in 2024. As many of you will be aware, a lot of the emissions are tied up in the supply chain. In the Norway hospitals last year, about 80%. And you can actually find these data for each individual regional hospital trust and each hospital below in the region with the different categories for emissions, and showcased here that information technology, according to the hospital's own assessment, already at this point contributes to 9% of emissions from specialist healthcare. So clearly this risks growing in coming years. Sorry. It's also possible to use this dashboard to monitor emissions over time. And as been highlighted before, given aging populations, we risk emissions from healthcare going up in coming years unless action is taken. For those of you who are interested in learning more about the dashboard, I can put a link into the chat once I'm finished. And there is also a case study which we prepared for COP28, where we illustrate how the dashboard is useful and how emissions from the anesthetic gas desflurane has reduced in recent years from 2019 to 2024, reduced by nearly 95%. And this has been done without any legislation in any form, mainly by awareness raising among clinicians. Yeah, the dashboard also shows a lot of information about transport emissions. Interestingly, for example, we can see that there is a ranking of top hospitals in terms of transitioning to electric cars. And interestingly, the trust in Northern Norway, which presumably has the coldest weather and the longest travel distances, is the one that is on top with using 100% electric cars for patient transport. A recent development is that regional health authorities have been tasked to create trajectories for prognostics for future emissions. So this will help illustrate to hospital leaders several things, including what will happen if I take this action, but also what will happen to emissions as a result of inaction. So development of emission trajectories is an area which is being worked on at the moment. So just to speak very briefly to the experiences so far in terms of implementation of the roadmap and evidence of its uptake. It is helpful, of course, that the Ministry of Health can instruct specialist healthcare services to use the roadmap as a resource in their work to reduce emissions. And the hospitals have a defined target of reducing emissions by 40% by 2030 before reaching net zero in 2045. And there is a lot of activity in the hospital sector, for example, in terms of international collaboration when it comes to procurements, but also on the local trust level, where Oslo University Hospital recently launched a new sustainability strategy. There is a clear potential for further uptake of the roadmap, and in particular, how we address this theme in municipalities. I think there are lots of low-hanging fruits that can still be picked, for example, in terms of inhaler use and how we promote the roadmap to a range of stakeholders. So that's it for me. Thank you so much for listening, and I'm happy to take any questions.
Thank you so much for that presentation on all of the great work that you're doing in Norway. Much appreciated. All right, we will jump over to a presentation with Alina Atema and Anna van der Togt. Alina is with the Dutch Green Deal on Sustainable Healthcare, and Anna is with the Ministry of Health, Welfare and Sport on Netherlands. They will be talking about the greening public health in the Netherlands, a midterm look at strategy, progress, and challenges. Handing it over to you both.
Yes, thank you so much. Thank you for the introduction. We're happy to hear everyone else's story and also happy to present ours. Just some context before we dive in. You can see here the percentages of contribution that our healthcare system has in different types of planetary impact. Our emissions, our carbon emissions, are really quite high, also compared to other countries, but it's not the only category in which the healthcare system has quite a big impact on our environment. So that shows you kind of where we are. Our presentation is a little bit more focused on the policy instruments, focused on, getting there than on how we calculated this. So if you have more questions about the former, then we're happy to speak to you at another time. Just a very brief understanding of the Dutch healthcare system. It is not a centrally-led healthcare system. It is a regulated market with private healthcare insurers, private healthcare providers, and then obviously patients or individuals having access to care. So we don't have a very direct impact on this market, and that shows in how we approach this challenge. We do have some part of our healthcare system that is centrally organized, and that is public health. So national vaccination programs, for example. So that's just for you some short background info. We're going to show you our two key policy tools for sustainability. And the first one is the Green Deal Sustainable Healthcare, which connects the government to these private healthcare providers and a range of civil society organizations. And then we're going to show you a little bit more about the program for sustainable public health and welfare, which focuses more on the government itself and on policy levers that it has and on the knowledge behind that. So I'm going to hand over to Eline, who will tell you a little bit more about the Green Deal Sustainable Healthcare. I hope Eline is able to come up.
Hear me now?
Yes, there you are.
Okay, sorry, my device was doing weird, so I'm on my telephone, so excuses for maybe the bad sound. But I continue very quickly. on the Green Deal Sustainable Healthcare, which I'm coordinating, and next slide, please. Yes, the Green Deal on Sustainable Healthcare is actually a sort of appointment, how do you say that? A mutual agreement between the health industry, the government, and it's not legally enforceable. And you could see the Green Deal as a sort of a roadmap towards a sustainable healthcare. It goes for 4 years, this covenant, and the goal of the participants in it is actually to create awareness, to inspire, but also to getting things done in sustainability. So therefore, we chose 5 leading themes, and I will not go into all of them because this presentation goes about CO2 emission reduction. That's what you're interested in. So that's our theme 3, and I'm going to talk more about that. It's also actually our most successful theme because it's very easy, kind of. So I will tell you about that. Anna, sorry, next slide. Yes. The reduction of emissions are successful because we were helped by the Paris Agreement and the EU legislation. Those were setting milestones, and we have to get to obey those, sort of. So for hospitals and care facilities, it's easy. There are roadmaps. We have a technical organization, TNO, and that makes roadmaps for hospitals, and that writes down how they can reach emissions. There's also a lot of support in the boards of hospitals and care facilities because with these roadmaps, they get subsidy from our government, from us actually, and we call that social real estate regulations. So it's kind of low-hanging fruit for hospitals and facilities to do this emission reduction. Next slide, please. Yes, I'm going behind this. Sorry, Anna, I skipped this. Yes, this is what I want to show you, the actions, because what kind of actions are hospitals doing to require that emission? Well, of course, there are a lot of hospitals now with solar on their roofs, but also heat pumps are coming up more and more. They have different air ecosystems that try to reduce the CO2. There is more electrical driven equipment, and there is a whole lot of other things that they are doing to get the emissions as low as possible. And one of these actions I will look into a little bit further. That's the mobility of clients and workforce. There's also a roadmap for that. And what we are aiming at is that patients, clients of hospitals, but also the workforce that works in the hospital don't go by car so much to the facilities, but use other sorts of public transportation because you can really gain a lot of CO2 emission with that. And a nice example is that one of the hospitals has bought like electronical buses, and they ride up and down with clients, but also with people that work there from the train station to the hospital. And then that's really makes a big difference. So that's one of the examples. Next slide, please. If you want to hear more about the other things of the Green Deal, I will be more than happy to tell you afterwards. But for now, I leave it to this. But I really want to share also with you, we are on half of the Green Deal. The Green Deal is a sort of roadmap as well. And what we are facing now, we did a midterm evaluation. And what we are dealing now is that some of the early adapters, okay, they do what they have to do and they are there. But we now need to reach the majority to go green. And that's what we are facing up to now. But I think we will manage that. And also we need international cooperation for that. And that's why I give Anna back the floor, because she's going to fill in on that. I hope.
Anna, I think you're
Sorry,
on
I was still muted. I'll reflect a little bit more on the second policy instrument, which is Program for Sustainable Public Health and Welfare, which focuses more on the knowledge creation around this topic and on how we try to change as government, how we are trying to tackle our own policies to include sustainability more. The goal of this program is to contribute to this bigger transition to a different type of health care system that has less impact, but from the government's perspective. And obviously, we try to do that by coordinate our own support in that Green Deal, drive and embed action where needed, and ensure that it gets integrated into our policies. So that's kind of one of the biggest focuses of this program, to make sure that across our health department, everybody understands what sustainability is, what are the different elements of it, and making sure that it gets kind of embedded in how we see good healthcare, so that everybody understands that that's a part of good healthcare, that it's sustainable. The second focus of this program is to promote and fund research, and a part of that is the monitoring progress and impact. You see it here at the bottom. So that is the carbon footprinting of the sector. The goals of this program are very similar to the Green Deal goals. It has a slightly different twist to it at the end, because we also have some cross-cutting teams that are focused more on awareness raising, on knowledge and research, and on legislation, regulation, and enforcement. And there is an added element that focuses on climate adaptation of the whole sector. Just some examples of how we are trying to approach this policy, through policy, is, for example, a big program that we launched that is about food in the healthcare sector. Quite a lot of people work in healthcare, so if they change their dietary habits to a more low carbon or less polluting diet, that's actually already quite a big impact, and it's also quite often more healthy. So it's kind of two birds in one stone. It is a program that's quite successful and that has now a follow-up program. Another one is that we're looking at, hey, can we change what's important in changing regulations about safely redispensing unused drugs. We're trying to do some pilots here and take those learnings into European policy processes. And like I said, we're taking a look at what is needed to be ready for climate impact in different ways. And of course, the monitoring our footprint is really important. So our research institute, our IFBM, did a first carbon footprint in 2022 and has a next full update scheduled for next year. And establishing that baseline was quite important, even though these policy instruments were already running when we had this first baseline. So we didn't do it in the same order of things that we saw other people present. And we're currently further developing our methodology, because we don't only want to focus on the carbon footprint and focusing on the climate aspect of it, but we also want to include other planetary impacts. So to end this presentation, some reflections from our side. Linking sustainability to other key challenges is quite important to make sure that you have continuous political support. Quite often, there are other benefits to a lot of our sustainable efforts. And if you can combine those, it's just a lot easier to make sure that a plan survives a government that is very green oriented and transfers to a government that isn't. True adoption of sustainability as part of the key qualities of good health takes a lot of time. We're not nearly there. And it's quite difficult feat. And like I said, monitoring and measurement is not optional. It's very important. But if you do have a program locked in for 4 years, like we had, you can even start without that baseline, as long as that baseline is done within those within that period. So that's it. Thank you so much for listening, and for the other presentations as well, for sharing.
Thank you so much, Anna and Elena, especially for those lessons learned, always so incredibly important. So thank you both. Thank you also to all of our other presenters who have shared all of their insight and inspiration today. We now have a little less time, about maybe 10 minutes for Q&A before going on to the next and final presentation. So I will pass the floor to Elena Villalobos-Prats with World Health Organization to facilitate the Q&A.
Thank you very much. And I see that there are many questions already in the chat that I would like to reflect a little bit on. But I think the first thing is to really thank all of the presenters for these great experiences and for sharing with us the process and success of how different countries, in this case, Norway, Colombia, and the Netherlands, have gone about developing these plans. Maybe I will start with the first question. I see that Corelia has a comment to Colombia. Maybe Corelia Kostovic, do you want to raise your question directly to ask it?
Yeah, it's simply about when I was looking at healthcare systems carbon footprint, I saw that Colombia was very low. So I was just surprised to have a presentation today from Colombia and having initiatives for decarbonizing, and when you are actually very low already. So that's why I was curious to understand what made you think you had to do more. Voila. I don't know if you could hear me. I know the camera is frozen for me.
Yes, we can hear you. It's Elena's internet connection has dropped out. My name is Amy Savage. I'm also at WHO in the Climate Change and Health Unit. Diego, would you like to make any comments on that question from Corelia? If you're still there.
Sí, claro que sí. Efectivamente, ver cuánto es el aporte de Colombia en la comparación global es mínimo. Es mínimo las emisiones que se generan, y asimismo en el sector salud. Pero frente a las acciones que se han hecho, recordar que hicimos una estimación de huella. Sin embargo, faltan muchas acciones de mitigación, y es claro que este primer ejercicio va a servir para eso, para impulsar esas acciones de mitigación dentro del sector salud, que todavía falta muchísimo en el país, y que esto pueda convertirse en un instrumento de planeación, que es, como lo mencionaba, dentro de nuestro plan de gestión de cambio climático del sector salud, que se lanza este año. Entonces, esperamos que eso apoye para generar pues más acciones contundentes frente a la mitigación de cambio climático en el sector.
Muchas gracias, Diego. We also have some questions in the chat for Dr. Earlett from Norway. I don't know if Gillian, did you want to speak and ask your question directly, or would you like us to read it out? Okay, I don't see
Yeah, I don't think
Gillian.
Gillian's there.
Oh.
Yeah.
You're there, Gillian? If not, I read the question out. So Gillian was wondering, Erland, if you could speak a little bit more on your comment about pairing the digitalization agenda with the greening agenda. She's mentioning that since rapid digital development, including but not limited to AI, is responsible for overrunning carbon and other waste ecological budgets. I don't know if you have any comments on that, considering your roadmap and action plan in Norway.
Yeah, absolutely. I perfectly understand the question. So I think there are several perspectives here. So it's clear that digitalization to some extent can be helpful in the greening of the healthcare sector, because telemedicine, for example, can help reduce travel, and maybe artificial intelligence can help us interpret imaging better, so we can reduce unnecessary treatments, for example. However, it's also clear that the use of digital technologies and artificial intelligence requires high amounts of energy. So, for example, as a simple query in ChatGPT or similar tool requires like 18 to 20 times the carbon emissions or energy use that a standard Google search would require. So it's very important that artificial intelligence algorithms are developed so as to conserve energy, and that the energy sources used are as green as possible. The other argument I wanted to put forward was that there's a lot of resources, a lot of attention um, on the digital transformation or transition in healthcare. So if those people who work on the digital transformation can start to think green digital transformation, then I think this would help the overall greening agenda. At the same time as it can be helpful as an additional argument for those who work on digital transformation. So I'm trying to find or to put forward the argument that we need sort of everyone on deck to help with the green transition of healthcare.
Thanks so much. And there is another question for you in the chat. Shoko Misaka, would you like to ask your question directly?
Yeah, thank you very much. First of all, thank you for all of your presentations. So it was great to learn about the three excellent examples from Colombia, Norway, the Netherlands. Thank you very much. So I have questions to Dr. Erland. What do you think was the key factor behind your ministry's success in leading the development of the roadmap? So was it because the climate change and health agenda is mainstream within your ministry? And also, if possible, so could you please share what the biggest challenge was in formulating the roadmap? Thank you very much.
Sure, thanks. I struggled to hear one part of the question, but I heard two parts of the question, so I'll start by answering those. In terms of the key factors for the success of the Ministry of Health's leadership of developing the roadmap, yeah, I don't know. I think it helped that they had the working group in the ministry, which sort of worked across departments and got engagement from representation from specialist care, primary care, public health, etc. But they also had a sort of steering group structure where they had executive decision capability on board. So that was probably also a link to the success. So the way things work in Norway, the Ministry of Health has maybe around 250 people working there, whereas the Directorate of Health has around 850 at the moment. So they use the Directorate sort of to do some of the work they need to get done, to provide the input, and in terms of the roadmap, do a lot of the work in the Directorate, and they said, yes, this is looking good, continue in this direction, or input like that. The biggest challenge in formulating the roadmap, I think part of the challenge here is that the audience is extremely broad, and the themes you have to cover is very broad to take a wholesome approach. So the question is sort of, how do you reach individual stakeholders around the health and care sector with messages that are tailored to them? Because the agenda can become a bit too overarching or too high level to reach everyone. Say those who work on service design in a particular clinical field, they need different information from those who work on procurements, for example. At the same time, we somehow need to, I think it's beneficial if we can generate the feeling that everyone is on the same team. So one example of this targeted communication is that at the University of Oslo, some students developed a sort of one-page poster with specific actions that can be taken by general practitioners. You know, if you're a general practitioner, what can you do? So this was a one-page thing with like 10 actions that can be taken relating to inhaler prescriptions, telemedicine, etc. So I think we need more of this type of simple communication tools, for example.
Thank you very much. Thank you very much.
Thanks so much. So I think we've got maybe time for 1 or 2 more questions. I don't see any hands up, but please do raise your hand. Oh, I see one from Diana. Diana, go ahead.
Thank you so much for that, Amy, and thank you all speakers. I had a question, and this kind of came up in some of your presentations and the presentations from the morning session. There is this need to balance also the adaptation components and the environmentally sustainable and low carbon components of healthcare delivery. Are you seeing some of these areas where actions could be already matched or be integrated in an easy way, some easy wins that way, as you've been prioritizing your actions for low carbon and sustainability? Thank you.
Thanks, Diana. Was that directed at anyone in particular, or is there anyone in the panel?
Yeah, any of the 3 countries, really. Yes, thank you.
Okay, I can see Alan has his hand up. Go ahead.
Yeah, no, I think that's a very good question, because we, when we set out to develop the roadmap, it was around low carbon because that was the COP26 commitment. But then, as the process went along, it was felt from the ministry that we should also speak to adaptation. So one of the challenges is that even if the executives are the same in terms of being responsible for both mitigation and adaptation actions, the people who will be carrying out the relevant work, they're quite different. So this is a challenge that maybe sometimes it's a bit difficult to communicate, but it's really, I feel the nature of the work is quite different. The first example that comes to mind to me is sort of the nature-based solutions type theme, which can be helpful both for, creating healthy environments and helping with, resistance to extreme weather events, etc. But yeah, I'd be keen to hear more examples myself.
Thanks so much, Ellen. And yeah, go ahead, and then Diego.
Oh, I can reflect on it a little bit from our side. Yeah, I totally agree. Ireland is completely different people approaching it, and also whereas sustainability and kind of mitigation in general is a topic that kind of came up all at once. Everybody was looking at it for the first time at about the same time. Adaptation is slightly different because in a lot of instances we already do have some crisis systems set up at different levels. So I think in most countries every hospital has a crisis plan, or every region has different types of crisis plans set up to make sure that in times of, for example, extreme weather, they do react in some way or another. So this topic is slightly more difficult because it is spread out in different types of in other ministries. For example, our infrastructural ministry knows a lot about how do we make sure that our infrastructure stays well in different weather circumstances. So that's slightly different. And also there's this big difference between adaptation if you look at public health versus adaptation if you look at health care and cure and the kind of the infrastructure of health. Because public health is more about how do we make sure that we are ready for different types of diseases, which is more gradual than the more crisis type of adaptation. So that's just some reflection. So for us, it's actually quite a wicked problem that we're still trying to untangle and tackle.
Thanks, Anna. Please, Diego.
Sí, no, en mi opinión, precisamente es supremamente importante tener los dos componentes unidos, por eso nosotros estamos formulando ese plan integral. Nosotros como país altamente vulnerable a cambio climático, a variabilidad y cambio climático, hemos trabajado mucho más en adaptación que en mitigación. Desde hace cerca de 7, 8 años tenemos ya temas más avanzados en adaptación. Sin embargo, es muy importante que vayan de la mano, entendiendo que esas acciones de mitigación también generan cobeneficios en salud que de cierta manera se convierten en una medida de adaptación por temperaturas extremas, por temas simplemente de cambio de entornos sostenibles que puedan generar menos riesgo, por ejemplo, de enfermedades transmitidas por vectores. Hay diferentes acciones que de cierta manera generan co-beneficios y que tienen que ir juntas o que una genera también un beneficio colateral para la otra. En ese sentido, sigo pensando que la adaptación es mucho más amplia, estoy de acuerdo con el comentario anterior, es mucho más amplia, no es solo sobre la infraestructura, sino que debe enfocarse a personal de salud, debe estar dentro de todo el sistema, debe hablar de epidemiología, debe hablar de muchas cosas, pero por supuesto de la mano de acciones que pueden ayudar de manera de co-beneficios. Entonces, eso es como lo que quería mencionar.
Muchas gracias. Well, I think we're probably at time now for the Q&A. So if there's no other burning questions, I will hand back to Cara.
Thank you so much. And if you do have additional questions, obviously, please drop them in chat and we will be able to we'll get to as many of those as we can, and then we can reach out to folks after. So I know we're running close on time. I would love to hand the floor over to Sol Aliano with Healthcare Without Harm, who is going to introduce the diagnostic tool to you all. And there will be some time for Q&A on that as well. Thank you. Sol, over to you.
Thank you. Can you hear me well?
A little quiet, but yes.
And this is better?
A little better, yes.
Okay, great. Let's do it like this. So, are you seeing the presentation?
Yes.
Well, great. Well, hello, everybody. Thank you for joining us today. I'm Sol Aliano, the Carbonization Advisor at Healthcare Without Harm. I will be introducing you to a new diagnostic tool for developing action plans and roadmaps. This tool is part of our broader effort to support countries in healthcare decarbonization. So what exactly is this tool? This tool is a questionnaire-based assessment, which goal is to provide clarity on the most effective way to to develop an action plan, a roadmap. As Andreas highlighted earlier in his presentation, conducting a diagnostic assessment is a key foundational step in action planning, and we understood it was necessary to systematize it. So through this tool allows us to identify key gaps and needs, allowed us to evaluate whether expectations are feasible, and define right from the start how the best streamline the development and implementation process. So through this tool, we will be looking for preliminary information. So users of the tool are asked to answer a series of questions. The first set of questions focuses on expectations around the road mapping process. So here the goal is to align stakeholders on what the roadmap should achieve, clarify roles and responsibilities, and ensure that expectations are realistic and suitable for the national context. So we will look for existing laws, climate strategies, and international commitment. Here, there are also questions related to timelines to ensure that everyone shares a common understanding on the project duration and the key milestones. We also explore future events that may affect timelines or deadlines. Technical capacity is also addressed, so this includes identifying in-house skills or the need for external expertise in areas like policy analysis, emission modeling, statistics, or environmental management. We want to understand whether the technical foundation exists to support the plan activities or whether capacity building is necessary. So we also look for financial resources, whether to understand if there is available funding to expand technical capacities. We also explore the existing knowledge around GHG estimation and action planning. And finally, we examine the stakeholder landscape and governance structures because emissions come from multiple sectors, you already know. So it is crucial to know early who hosts the data, who will be involved in the process, what are the existing structures, if there is any, like an interministerial body, something that might support the coordination. So all of that was about capacity. We also have a section on the tool regarding data, but not only about data, but data availability. And I want to highlight it because it's not only about data, but about being able to reach to get that data. So the tool covers three main types of data. We are asking about three types of data. First, activity data. Second, expenditure data, broken down by procurement categories. And third, proxy data that might help us yes, to get up to activity or expenditure data. So, as I said, it is not only about knowing if the data exists, but also knowing, being able to identify in advance who owns it, who has access to it, whether there is any restrictions on sharing, and how data can or cannot be exchanged across ministries or agencies. We understand that knowing these limitations is really important in this process to know that at the very beginning of the process. So how the tool looks like? Well, it is basically it is two main sheets. So in the first sheet, we are asking users to provide information, the data I already mentioned, activity, expenditure, or proxy data across various emissions categories, such as transport, energy, fuel consumption, inhalers, anesthetics, etc. And then we have a second sheet, which is the capacity sheet, which includes questions about the topics I mentioned, grouped in 3 categories. So the past and the current efforts to reduce emissions in the health sector, objective and expectations for future action, and institutional arrangement, including the governance structures and resource availability. So we understand that this structure approach help ensure that all key elements, both technical and strategic, are covered in a way that supports informed decision making. So once the tool is complete, once these 2 sheets are completed, by compiling and analyzing the responses, a set of customized recommendations are elaborated. So these recommendations will cover topics such as data systems, governance models, boundaries, definition, resource planning, both in the financial and human perspective. So let's see 2 examples, 2 hypothetical examples to illustrate how the tool works. So let's assume we have country A with a very limited data availability and difficulties to accessing the data from other ministries. Their planning efforts are happening at the district and provincial levels. The good news is that they have sufficient financial resources and a 2-year timeline. So for this tool, for this country, potential recommendation may be estimating emissions using a representative sample or region of facilities for conducting a granular level estimation or a bottom-up, setting up a centralized data governance system, developing regionally action plans, structuring the project timeline around key phases like data collection, baseline development, and action planning design in order to use efficiently the time available in order to understand from the very beginning that we have multiple stages to get up to the final goal. And then we could also have country B, which is very different in this case, as it has a national mandate for sectoral action planning and a well-established data sharing mechanisms. In fact, planning is being led at the national level by an interministerial task force. However, they have limited technical expertise internally, and funding is available, but timeline is tight, just 6 months. So in this case, the tool might suggest a top-down approach while recommending also a hybrid element for flexibility. It could advise investing immediately in technical capacity, engage the tech support from the very beginning, and divide the goal to initiate with a first stage project that might be expanded upon in the future. So this is all that we prepared to present the tool. We hope this presentation has helped clarify how the tool works. You can contact us if you want to learn about more about the tool, or if you want to use it. We are piloting it before we make it available through the community of practice. So thank you, gracias, merci for your attention. And now we are launching a quick poll. And then I don't know if we have some minutes for questions.
We probably have time for 1 question if there are any in the chat. So do you see the one question in the chat?
Yes, I see it, but I think I don't know for who, if it is for regarding the diagnostic tool. It seems more like for a general question, right?
Okay, excellent. All right, would you like Claire to show the results on the poll?
I'll leave it open for about another minute just to get some more answers in.
Excellent, thanks, Claire.
If I may, Kara, it would be great to hear from particularly Norway and the Netherlands, but Norway's, given that they are tracking and having that fabulous dashboard to see whether they can actually answer the first question. And for the second question, I know there have been some health systems in the US particularly that have been looking at patient preference and options. It really bodes well in the US given its own health system and how it is focused a lot on choice. Knowing that we could look at some of those resources and see if we can find some presentations to share as well. But over to Norway or the Netherlands if they want to speak about data analytics.
Ellen, do you want to go first?
So the question, is it the same that is in the chat about how data analytics can help track progress?
Yes, that's correct.
It's a fairly big question. I mean, what I think would be the overall aim is to have data and emissions being part of the overall decision making at the same time as financial budgets are part of the decision making in when shaping the services, healthcare services of the future. In addition to this, it's also very helpful to have emissions data on individual treatments so that different treatment modalities can be considered and compared with one another. So if two different treatments have say similar financial cost and patient outcomes, but one has lower carbon emissions, then you could prefer the one that has lower emissions. So that's just an example. I think in the future we will hopefully have much more data available on the emissions coming from individual medications and medical equipment. We sort of don't have that information to hand now. So it's difficult to make informed choices when developing services. So here's an opportunity to work jointly with the medical industry to develop standards, for example, in terms of how we estimate those emissions.
Yeah, short reflection from my side. So the way that our footprinting analysis is set up is that it's really looks at kind of the national level, which means that it's quite difficult to trace it back to individual treatments, for example. So that would require analysis per treatment or on a hospital level, because the national one is really done in a more bulk data type of way. So it does help us see, okay, the biggest impact is in this or that, but it's quite a crude overview still. And to then translate it to, okay, that means that for these type of healthcare interventions, we should choose this treatment instead of that one and make sure that that treatment gets insured in our case, that's the treatment that you get reimbursed for. That's not at the level where we are currently, because that needs much more data. There are still this is starting to happen because our hospitals, our healthcare providers are increasingly doing analysis of their own and are sharing their data across provider, which is incredibly useful and important. So kind of, I think this is a bigger topic that that is in the bigger community, that is framed as the best buys not only in terms of effectiveness, but also in terms of affordability and in sustainability. So please check out that bigger discussion, because I think it's incredibly interesting, because there is this difference between this high level footprint and translating that to the really concrete treatments.
Thank you both very much. That's going to close out our Q&A at the moment. And I know we're at time, so I'm going to kick this over to Elena Villalobos-Prats to do any next steps in closing.
Thank you. I will try again. Sorry for the technical issues before. I think I would just like to thank all of the presenters and all of the participants for the amazing presentations that they've done. I think from my side, it has been very useful to see the different approaches that different countries have undertaken. And I think the questions and also the responses in the poll are very useful for us to continue developing these webinars. I think participants have a need to focus on concrete interventions, which is coming from the different responses. And I think questions around also political engagement and how to ensure that this continues to be a priority within the ministry, how in your respective cases, for example, in the Netherlands, in Norway, and in Colombia, you manage to get this political support and buy-in. So that will help us to shape the future. I think at the same time, there is a lot of questions around data, baselining, and I think it's important to highlight that what we really want to see at country level and what we are seeing is basically action. So, for example, Erlen was providing a set of interventions that they implemented around transport, around food, around anesthetic gases, that are probably low or no regret interventions that can be promoted by countries in any case, if they aim to develop these action plans and to start reducing their own emissions while potentially advancing in their capabilities and in their data sets to really do a proper assessment of emissions. So I think we can advance in parallel in those regards. I think that's it from our side. This has been very useful for us. And I really probably just thank again all of the panelists and the Healthcare Without Harm team and WHO team that put this together. So with this, I think we can close the meeting. Thanks so much.